Joining us now is public affairs analyst and journalist ONYEGBULE to bring us up to speed with understanding some of these issues. good morning.
Good morning.
It's nice to have you join us now.
Good to see both.
Now, I wonder what you make of the viral way that this disease is going vis-a-vis, side by side with the call for preventive measures and all the videos and all the instructions that are going out, but yet it is still spreading. Would you say there is effectiveness of the information that is going out on how to prevent this disease?
Well, I think there is, but when you look at it, this is a disease that is affecting people beyond human comprehension, because you'd expect that countries that have all the facilities that you can think of. Think about China and how many days it took them to put up a hospital, a standard hospital, because of this, and this is still affecting
more than
them.
1,000 beds.
Yes, as it is now, over 90,000 persons, of course, have been affected right there in Wuhan. Talking about China, you look at Italy, what it is they've been through. You look at other countries also. And I want to say that Africa is quite lucky. I don't understand what it is. Remember what it was with us. When you think about the Ebola era, Africa was hardest hit by it before other countries started to suffer. But when you look at this, there are measures everywhere. Everywhere you go, I'm sure I use hand sanitizers like 5, 6, 10 times a day. Everywhere you go, there's a sanitizer. They're checking your body temperature. They're spraying all sorts of things. And I'm hoping people don't get to gas themselves with the way they're spraying all sorts, But when you look at it, I think scientists or healthcare professionals, they must be trying to find a way to get to the root of this. I was going to speak with somebody who works with the Lagos State government, the SA on health, as it is. She was supposed to be on a show with me so that we can talk about what it is with Lagos and its preparedness, talking about fighting this coronavirus. And she said to me, I'm sorry, I won't be able to make your show, which is actually 7 p.m. because every day, as she said, we're in Yaba and we're trying to see what we can do to keep the people safe. So I must say that the information is there. People are getting all the information. But I would also say to you that some people still don't believe that there's COVID-19.
Oh, yes. Absolutely. I was even getting to that. But then another difference between the Ebola time and now has also been the managing of information, like you've said, so that to control the media space and prevent fake news from filtering in. At the onset of this detection in Nigeria, of course, the rumors were already, filtering, but it does seem that we've been able to sanitize the media space by ensuring that the right information is properly channeled to everyone. What lessons do you think we can learn from all this as media practitioners?
You just talked about the right information now, and I will say to you that I must commend the people. I haven't seen anyone coming up with fake news to say this is this or that is that. Everyone's waiting for different, media organizations to say what is the latest, what's going on. Even the illiterate woman or man that you see on the street says to you, look, I'm sorry we can't shake hands, you elbow and you use your feet and all of that. So people are aware. They're not passing wrong information as it is. They're waiting. And if they know that you have the information, they want to hear it from you. And I think that the media should continue with what it is that it is doing. Let there be, in fact, they need to flood the whole place with information in the local languages. If I ask someone now, what do you want to say to the local woman in my village in Mbise? How do you want to explain COVID-19 to her?
Exactly.
So I think people who are into languages, who teach languages, should think about what words that they can actually use to pass these messages across.
ONYEGBULE, thank you so much for your time. Certainly, this conversation is going to go on because we have to keep doing everything to make the people know more.
We have to, because when you find out now, families are no longer sitting together, hugging.
Everyone is.
True.
Thank you. Joining us now is public affairs analyst and journalist ONYEGBULE. Good morning.
Good morning.
Nice to see you, really.
Good to see you.
Great. Now, I guess you have seen the videos that have been going viral that people have been commenting on. Now, you see, there's one recently where a young man was in a train and he put his hand in his mouth, kind of rubbing saliva on his hand, and then putting them on the rail, the poles that one holds in the train. These are recent, we can't necessarily verify what, when, that, and where for now, but you see these things, and these videos have been going viral. What impact do you think this is having on how the virus is going?
It just says to you that some people truly don't understand what is expected of them. I just watched now while the news was going on, the Canadian Prime Minister, who has agreed, of course, he has no other choice with his wife to stay away for 14 days. And I'm thinking, if it were in Nigeria, would you have government officials coming out to say, look, I have tested positive? So it may not be like that. But you see also in some other countries, I actually saw another video where you had some person from one part of the country where they're actually being ravaged now by this coronavirus. What he was doing in the lift, he was putting all sorts of things, you know, plastering the wall so that people can get to touch it. So I think it's about irresponsibility. It's mischief. It's not a nice thing for you to say, okay, maybe I've contracted this virus, then I don't have to die alone. Let me just do it so that other people can actually touch it.
Instead of just going to the authorities to say, I think I am down with a certain kind of feeling I don't understand, can I be tested?
That's it, you know. And if you've been tested and you found that you're carrying the virus, see what you can do to boost your immunity, let them treat you and all of that, not trying to infect others.
And that's on the one hand. Then on the other hand, as real as this is, we saw how it became a serious issue in the US, and now from 1 or 2 cases, it has now skyrocketed to as much as 25 at least. Still, there are people here in Nigeria and far beyond who do not believe this is an issue to worry about. How do you juxtapose it? Is it a failure of the system, of the media practitioners, or is it just you've done the best you can? Maybe someday they will get to realize.
I don't think it's a failure of the system or the media as it is. We're largely, you know what, the kind of persons that we are in this part of the country, it must be happening to someone I know close to me for me to believe. And that's totally wrong.
Thomas's.
Yes, because I had on the show, people were calling in to say to me, if there's nothing like that, because the government has refused to tell us or give us the name of the Italian who's the index case. And I say to people, what do you need the name for?
Exactly.
I have confirmed to you that I know someone who says to me, he works in that place where it is reported that the Italian went.
So there is no doubt.
And he says there's no doubt. So if you can hear it from me, what are you waiting for the government to give you a name? So I think we need to believe the government. At this stage now, you don't have any choice but to believe. Because even if they come out tomorrow to tell you, oh, COVID-19 was just a scam, at least you believed and you kept yourself safe.
Exactly.
That's it. Use your sanitizer. You don't have to break the bank to buy your sanitizers. You can wash your hands with soap and water. That's what the WHO has said. I see people wearing all sorts of things now. Yesterday I was in a place, you know, just to have pizza. There's this man who came in, a Chinese actually. He had the mask and he wanted to take his fizzy drink. He had to open the mask to his drink and not put it back.
Interesting.
So I was wondering, but is it not when you're infected already? That's when you use the mask.
That's when you need the mask, exactly.
So if you use that mask, you'll be scaring people away because they think that you have this virus. So we just have to be responsible. That's exactly what I would say. If you find that you have some flu-like symptoms, just report yourself.
And not panic.
Get tested. Don't panic.
All right. Well, hand washing is said to be one of the first ways to keep it away. And from there, if there's no water...
But is it possible not to touch your face? Is it not touch your face?
Well, it is advised not to touch our faces. But however, the point there is as much as you can. Well, ask the ladies.
And Mike will be the expert. Mike will be the expert.
Maybe you can hire me to make you up and all of that.
Joining us now is public affairs analyst Ife ONYEGBULE. She's also a renowned journalist. Good morning, and thank you for staying on the program. Coronavirus, so it's here now. As much as we try to prevent it, is here now. But looking at how the talking points are varied out there, China, some people have said, okay, China brought it in, continuing the war with China and its rivals, so to speak. But then there's also been the kind of narrative now. Some took offense with a particular media outlet, international outlet, saying Nigeria or Africa now is coronavirus is spreading in Africa as against the rest of the world. Do you see this as an issue that bothers you so much if Nigeria or Africa gets to be termed or labeled with the way it's spreading?
How come all the bad things are ascribed to Africa? That's the truth. But I think we should pay no heed to such, distractions now as it is. The numbers speak for themselves. When you look at the likes of China, you look at the likes of Italy and some other countries in Europe, I'm sure many will agree with me that the US has actually seen a reason why it has to shut its borders, airports to anyone coming from Europe. And it's because of what is going on in that part of the world. So I don't think that labeling Africa or tying it to coronavirus as we speak now is an issue. I think it should not just distract us. Let's try as much as we can to contain the 1 or 2 persons that have been found, to be infected with the virus. So I think that's what Africa should focus on now, not the propaganda that's going on.
All right, now there has been a frenzy across the world when it comes to how the story, the media, the trends have been going on both broadcast and the print media. Now, how has that compounded the issue, or how has that helped to ameliorate the situation of coronavirus?
Talking about compounding the issue, it's always been a very big issue when you talk about numbers with us here in Nigeria. I want to talk about Nigeria. You find out when there's an accident, one paper would say 20 people, the other will say 10, the other will say 15.
The figures will always,
the figures will always be different. They will be contrasting. But this is it. In Lagos, we only know, in Nigeria as it is, there are just 2 cases. One is the index, and the other is the person who came in contact with the index case. But there was also a report that government is focusing on Plateau State, where some people are, suspected to have the virus, so they're going to be tested and all of that. But I think that the media has done well. If the media does well, let's give them a pat on the back. Okay. They've done well. Stations are talking about it, on-air persons are talking about it, reporters are talking about it. As it is, I'm telling you, we are staying on the issue. And I don't think anyone should come and hit the media to say that they are fueling any, because when you have issues about people who are hiking the price of hand sanitizers, you have to report it. And when you report such things, people who do not understand would think that the virus is all over the place. So I won't say that is the fault of the media. I think people should also find exactly the right channel. The United Nations has actually said that find the right channel where you get the correct news.
ONYEGBULE, thank you.
Thank you
for
so
your
much.
contribution.
Thank you very much. Thank you.